We're going to talk about Chapter 6. This is Conception and Fetal Development. Remember that Chapter 6 is only page 149 through 167. I'm not going to get very detailed into genetics, that component. We're also not going to go into grave, deep detail into conception and fetal development. I want to hit the highlights of this because there's so much information that goes into what happens with fetal development and the process of conception. Some of the process of conception you guys probably learned back in anatomy and physiology. So we're really going to focus in on kind of the highlights and some of the refreshers so that we can get pregnant and move through the stages of what occurs during the pregnancy and factors that influence it so that by the time we get to the end that we can also have a baby. So we're going to talk about a couple of things on this particular slide. We're talking about cell division. So just as a refresher, mitosis is the body's cells that replicate two cells with the same genetic makeup as the parent cell. Meiosis is where the germ cell actually divides, decreasing their number of chromosomal numbers in half. So this is where we have the gamete, where we end up with 23 pairs of chromosomes, or 46 singles, but 23 pairs is usually how most people or books reference it to. The other thing we're going to talk about is when we talk about spermagenesis, this is where the male reaches puberty and the testes begin to kick into play and become productive as far as when we talk in terms of reproduction. Then you have oogogenesis, which is the egg or the ovum. They're kind of used interchangeable. And this is where that formates. So we have the egg or the ovum, and like I said, that's used interchangeable. When I'm talking in reference to your slides, I will try to use both terms and not just one versus the other so it doesn't get confusing. We know that it is important that we have to have an ovum and a sperm in order to become pregnant or to conceive. Just a couple of things. The sperm or semen contains a teaspoon. If you have, and you take just a teaspoon of sperm, you have 200 to 500 million sperm floating around. So if you looked at it under a microscope, that's what you would see. Now you have to think you have all those sperms, but it's very few of them that really make it to the egg in order to conceive. It usually takes an average of 4 to 6 hours to actually transport the sperm to move through and to meet the ovum. This textbook that you guys will be using in the fall is actually a very new textbook. I do like the fact that it has a lot more updated pictures. So there are a lot of pictures within this textbook if you're more a visual person. Just a couple other things. 6 to 10 days after conception, there's something called a trophoblast. This secretes the enzymes, and this causes a burying into the endometrium, which ends up being our implantation. So this is the sperm and egg is connected, and now we're implanting so that we can begin to develop a baby. So in this picture, you're actually seeing where the blastocyst is actually embedded into the endometrium. So we're starting to form the different layers. One of the things that starts to develop is the chronic villi. These are very important because when we start to talk about genetic testing and we talk about samples that can be taken to look at genetic disorders, this is something that they will take a sample from the chronic villi. It develops and they are vascular. They obtain the O2 and the nutrients from the mom or the maternal bloodstream, and they also eliminate CO2. So they're starting to act very similar to what the placenta, once the placenta starts to fully develop, that's the placenta's job, to deliver oxygen and take waste and CO2 from and to the baby. So now when we talk about in terms of embryo and fetus, there are three different stages that you will hear. The ovum stage, or it's also called pre-embryonic stage, this is where we're developing, sperms meaning the egg, and we have conception and conceived, and a baby is going to start to form. Then we have the embryo stage, which we're going to talk about just for a little bit. This is day 15 to 8 weeks after conception. So 15 days or day 15 up to 8 weeks of after conception. The embryo actually measures 3 centimeters crown to rump. Now, you have to remember, babies actually really look like little kidney beans. And I'm not an artist by any means, and it actually looks a little backwards, but they really haven't fully developed this early in the game their extremities. So when we measure them, we're measuring crown at the top to the rump at the bottom. As we move through and we get to the fetus stage, this is where they'll start to develop their actual limbs and extremities, so the measurement will change a little bit. So when I talk crown to rump, that's what I mean. Think a kidney bean, because that's really what an embryo looks like in the very beginning. Then the other stage is the fetus stage, and fetus is 9 weeks up until birth or after birth. The other thing about the embryo stage, though, this is those crucial weeks. We're talking up to 8 weeks. So this is where all the organs are developing. This is where external structures are present. So we have a lot of things going on to make this baby more human. Well, not more human, the baby is human, but look more human like we do. Babies don't start off looking like we do initially. Remember, I said babies look like a kidney bean. This is a picture from your textbook of the placenta. The placenta is very important throughout pregnancy. One of the things that happens in the very beginning, 2 membranes develop. We have the choron, which develops, and it contains that chorionic villi that we talked about. And it's important because it covers the fetal side of the placenta. And if you can see on this picture, this is 2 different sides of the placenta. This is the maternal side, and this one is the fetal side. The maternal side's more meaty, fleshy looking, and the fetus side is a little more shiny. It almost looks gray. So with the membranes, we also have the umbilical vessels that are branching out over the surface of the placenta. This is important. The intercellular membrane is the second membrane that is developed, and it is the amnion. So you usually don't hear it called intercellular membrane. You usually hear it called amnion. It is very important because what happens is the embryo is drawing itself around the amnion, and it's forming that fluid-filled sac, which we know houses the amniotic fluid. That's very important because when we talk about amniotic fluid, this is what's protecting the baby inside of mom. We can't just have no protection if mom hits her stomach or if she's in a car accident. Something has to be protecting the baby. So with amniotic fluid, there is a couple of things that are important to know. Fluid is secreted by the respiratory and GI tract of the fetus. The amount of fluid plays a very important role because you can have too much fluid or you can have not enough. If we have fluid that is less than 300 milliliters, that's considered oleohydramnios. This is in your textbook, but I'll write it up here. and that just means low fluid, less than 300 milliliters. If we have a baby who has less than 300 milliliters of amniotic fluid, which can be measured, we are associating that with some type of renal abnormality. Now we flip it to the other side, and we have a baby who has greater than 2 liters of fluid. Then we have a hydramnios. So they have a lot of fluid, which can cause a problem too. One of the things that we would associate with a hydramnios is GI malformations, or there could be some other malformations. So oleohydramnios, think kidney, renal, we are not putting out. So you can compare that to a renal failure patient. They don't put out a lot of urine if you're in renal failure. If you have hydramnios, think of your alcoholic patients with their big paracentesis, waiting bellies, and GI issues could be a concern. So we do know that 700 to 1,000 milliliters of amniotic fluid is produced. It usually increases weekly as we go. It does change constantly because this is kind of where the baby is. The baby also starts to urinate inside, and the baby has that fluid extra. The baby will also swallow fluid. That's how they keep hydrated. So it does a lot of different things. It's also important for maintaining body temperature. This is also waste elimination. It's important for respiratory status. It's also where electrolytes are maintained for the baby. So the amniotic fluid is a very important process, or very important key, along with the placenta, for housing and protecting the baby. The other big important thing is, and we'll talk about it when we talk about some of the risk factors or things that can go wrong, is the amniotic fluid allows the baby to move around freely. If the baby didn't have the amniotic fluid and couldn't move freely, they would be all tangled up in their umbilical cord, and that's going to restrict blood flow, and that's detrimental to the baby. This is a picture from your textbook. The one thing I really want to point out from here, and that is important to know, because it is something that when the baby is born that we have to assess. We are assessing to see if there are 2 arteries and 1 vein. This is very important because the 2 arteries carry blood from the embryo to the chronic villi, and then the vein returns blood back to the embryo. So it's a gas exchange process. It is very important. You can have a baby who only has 1 artery or 1 vein. The occurrence of that happening is very small. If that does happen, they will usually look for other signs of maybe congenital malformations and maybe do further testing. It doesn't mean the baby won't be viable or do well. It just means that maybe they're linked to some other kind of a genetic disorder. Okay, now what you are looking at is a chart from your textbook at HCG. HCG is very important because it is your human chorionic gonadotropin. This is where after 8 to 10 days after conception, you can take a test and see if you're pregnant, because this particular level increases in a woman's body when she is pregnant. That hormone is spit out. It reaches its max level at about 50 to 70 days into the pregnancy. Then it starts to decrease and taper off.